I'd just like to welcome Aisha, who will be leading us through the webinar today, as well as the team from Mobile Creche and Tiny Totos. We're very excited to learn about your experiences today. So over to you, Aisha.
Hi, everyone. Thanks, Jasmine. It's a pleasure to be here. So I'm Aisha Yousafzai. I'm a faculty at the Harvard Chan School of Public Health, working in the field of early childhood development. And today I'll be presenting some work that we've been collaborating with both Mobile Creches from India on, as well as Tiny Totos from Kenya on, around the impact of COVID-19 on the young children and caregivers that they serve in their communities. And so to start us off, I'd like to invite our panelists from both Mobile Creches to introduce themselves, and we'll see a short film about the organization, followed by our panelists from Tiny Totos introducing themselves, and we'll see a short film about their organization as well, so we can set the scene for the context and then share the findings of our survey.
Hello, everyone. This is Chavi from Mobile Creches. I am heading childcare services and capacity building in my organization. Thank you. I'm very happy to be here.
Oh.
Thank you, Aisha, first of all, for inviting Mobile Creches to this webinar. Hello, everyone. Greetings from India. I am Deepshikha from Mobile Creches. And in Mobile Creches, I'm leading research and knowledge domain. So basically taking care of the monitoring and evaluation domain. Thank you so much.
Start the video now.
India, one of the fastest growing major economies in the world. If one casts an eye around at our growing cities, however, one wouldn't think so. That India is a young country gives us confidence. But are we doing right by our young children who want to build a life of modest dreams and hopes? This precious human resource, the citizens of tomorrow, continue to live a life of deprivation and hardship. We are neglecting our youngest population at a time it needs the most care. Our young ones need meaningful support, and they need it now. As Gabriela Mistral, Nobel laureate from Chile, said, "Many things we need can wait. The child cannot. Now is the time his bones are formed, his mind developed. To him, we cannot say tomorrow. His name is today."
जब यहाँ आए तो बहुत सारा मतलब दिक्कत का सामना करना पड़ा। हम लोग काम में जाते थे दिन भर, बच्चा को छोड़ के जाते हैं झुग्गी में। काम तो करते हैं लेकिन ना ध्यान तो अपने बच्चा ही तरफ रहता है। जैसे हम लोग को पता हुआ तो हम लोग तुरंत ही ये सेंटर के रेस में, मोबाइल के रेस में हम लोग तुरंत ही बच्चा छोड़ने मतलब चालू किया।
Mobile Creches resolve to bring care, love and nurture into the lives of these children from one of the most marginalized populations amid the harsh surroundings of a construction site and an urban settlement by providing health, nutrition and early learning.
When I was volunteering with Mobile Creches, it was a wonderful experience being on site with the children. There was so much enthusiasm. These children were loving learning, and the care between the carers and the children was almost like family. It was very beautiful to see.
Since 1969, the MC program has touched the lives of 750,000 children. We are often asked, why the young child? Science and economics are clear that the first 1,000 days are the most important. 90% brain development happens up to the age of 3. If we wait to intervene till after a child is 3 years old, it would have lifelong and life-changing consequences on social behaviors, educational attainment, and therefore adult earnings.
जो माताएं आती हैं उनके लिए तो आप देख लीजिए क्या है सिचुएशन। उनकी सिचुएशन ये है काम भी करना है, कम से कम 5-6 घंटे तो घर से बाहर निकलती हैं। कहाँ छोड़ती हैं बच्चे वो आप जानते हैं, चाहे पड़ोस में कोई निगाह रख लेता है, रोटी पकड़ा के चली जाती हैं, या उनको बड़ा बच्चा छोड़ना पड़ता है, या अकेले छोड़ते हैं और बच्चे गलियों में खेलते हैं। जो बुनियादी चीज़ें उनकी ज़रूरतें हैं उसके लिए कोई प्रबंध नहीं है। तो ये सिचुएशन जो हम कह रहे हैं कि शहर देश के बच्चों की है, वो एक बहुत खतरनाक सिचुएशन है।
Women bear the triple burden of earning a wage, keeping house, and taking care of the young, old, and sick. They need creches they can easily access in rural, urban, or tribal areas, at work sites as well as neighborhoods. So they can work, and their children are cared for with love to grow, learn, and stay healthy. But can just anyone do it? The linchpin are the childcare workers.
We know that to bring that right sensitivity and correct attitude, adequate knowledge and skills to provide quality childcare services, training and the trained workforce is very, very critical.
The Mobile Creches training program is anchored in its grassroots experience and its recognition of the huge responsibility this job entails. Being a pioneer in running and managing creches and recognized as a technical resource, Mobile Creches as a step to scale up childcare arrangements in formal settings is building the capacities of other NGOs, childcare workers, and government functionaries across the country. Is this enough? To make this happen for 60 million children in the country living in poverty and in dire need of care, we need to engage with state and national governments to bring change in policy and program and work through networks of like-minded individuals and organizations to make the issue visible.
ये हमारा मानना है कि जब तक लोग अपने हकों के लिए नहीं आगे आएंगे तब तक शायद बच्चों की स्थिति में बदलाव नहीं आ सकती है। बच्चों का अधिकार जब तक मौलिक अधिकार के रूप में नहीं सामने आएगा तब तक बच्चों के लिए हम सही ना नीति बना पाएंगे, ना इनके लिए हम ज़्यादा बजट दे पाएंगे।
Building awareness of communities therefore becomes important. And this is done by using multiple mediums such as street plays, puppet shows, and family counseling. We owe it to our children. Let's think together, act together, and sow the seeds for change by nurturing childhoods. We are all answerable to the next generation. We all have a stake.
Thank you. We'll now meet the Tiny Totos team.
Hi, everybody. Jambo, that's our greeting from Kenya. Very warm weather in Nairobi, and really excited to be here at this forum. My name is Mildred. I'm lead content developer for Tiny Totos. Thank you.
Hi, my name is Chepkwech Faith, and I'm the social impact data manager at Tiny Totos, specifically handling the ECD and health data. It's a pleasure to be here. Thank you.
Half the population live in informal settlements, with no state support for childcare before the age of 6, where are preschool children spending their formative days. The majority are cared for in informal daycares. 4,000 have cropped up in Nairobi to fill the childcare vacuum. These micro businesses give unreliable service to working mothers, make little money, and give substandard care to children, leading to a lifetime of lost potential. Tiny Totos, a Kenyan social enterprise, helps informal caregivers in lower income areas deliver quality childcare services. We give informal babysitters the tools they need to become successful childcare entrepreneurs, providing reliable and affordable care working mothers and children need to escape cycles of poverty. Our customized support package provides training, investment, technology, and network to help informal childcare entrepreneurs improve services standards and triple their revenues. Mothers go to work with peace of mind, while children under 5 can thrive and look forward to brighter futures of their own. Covid-19 created a huge challenge for us. With almost half of our daycares closed and their parents out of work, we had to be creative in adapting our learning content to the new social distancing environment to ensure children in daycares and at home keep learning and developing even from afar. Our core offering is a monthly take-home learning pack filled with activities, games, coloring pages, threading cards, flashcards, and crayons. The content is balanced between child-led and carer-assisted activities. To complement the pack, we provide parents with tech-enabled support consisting of daily education text tips. All our parents have basic phones. Bi-weekly video clips sent via WhatsApp to the 72% of our parents with smartphones. A YouTube site where our training clips are uploaded for free access. A bi-weekly radio show reaching an audience of over 200,000, providing parent and child-focused learning and nutrition content. A free phone number parents can call for advice. Monthly calls to track carer and child progress and use of materials. One of the huge positives of our COVID-inspired home-based distance program is that parents have become more engaged in their children's development than ever before. Through our calls, radio show, and WhatsApp chat groups, we have seen enthusiasm grow month by month. Our radio show has moreover led to a new community of families who have never attended our daycares subscribing to our tech-enabled distance learning program. Findings from regular development assessments lead to constant content modification to maximize learning. For example, social-emotional well-being became a particularly challenging area by July, with parents complaining children weren't responding to boundaries and simple guidelines. Probing further, we realized that with carers highly stressed by the economic downturn of COVID, their own fragile social and emotional well-being was making it hard for them to model or enforce positive social emotional behavior in their children. If we wanted children to flourish, we needed to help carers manage their stress. We therefore launched a new content and counseling program in August. Continuous assessment helps throw up new insights on how to adapt content to maximize learning and engagement. Even working on a budget at a distance during a global crisis, Tiny Totos Early Learning Program has shown how a tech-enabled model giving caregivers the tools and confidence to engage in child learning can have an enormous impact in people's lives. While long overlooked, community-based childcare has huge potential to transform itself and the community it serves with a little helping hand.
Thank you. So these two videos set the scene for the context of where these surveys were actually implemented during the pandemic. I'll now go into the details about the purpose of the survey and some of the key findings. So To begin, I want to provide a global snapshot of how the pandemic has impacted the lives of young children. And this really sets the scene for why we felt across mobile creches and tiny Totos, the importance of having localized data to understand the implications for local communities, their children, their caregivers. So we know that the pandemic has impacted every aspect of the nurturing care framework, whether that's children's health, their nutrition, the care that's provided to them, their safety, as well as opportunities for early learning. And as beautifully highlighted in both of these videos, it has also impacted on the environment of care, the stress levels of caregivers. And at the extreme end, we know that the pandemic has meant that close to many children have either experienced the sickness of a caregiver or they have experienced the loss of a caregiver. And in a study published using data from 21 countries, it was reported that just over 1 million children had lost either a parent or a significant grandparent. And it was more likely that they would have lost a paternal caregiver than a maternal caregiver. And this obviously has long-term implications with respect to children's well-being as well as their economic security. And multiple studies from around the world showed that there was an increase in mental health challenges experienced by parents. And this included depression, stress, as well as parenting-related stress. And several studies from around the world also highlighted disruptions to the protection that young children experience, their opportunities for early learning, as well as the quality of responsive caregiving that they were experiencing. And this was not just because of the lockdowns and because of the closure of safe spaces like early childhood care and education centers, but also because of the lack of support that was being accessed by families within their own homes as well. So the big figure that we're familiar with as an ECD community is that 250 million children are unlikely to meet their developmental potential in the first 5 years. But this number, as a result of the pandemic, is set to increase because of the disruption to caregiving. We know that close to a further 11 million children will now be off track in their early childhood development unless we are able to intervene and provide the much needed support directly to young children as well as to their caregivers. We also know that in addition to development outcomes, health and nutrition of young children has been disrupted. And this is both as a result of disruption to the services that provide health and nutrition during different moments of the pandemic crises, but also because caregivers themselves had fears, had anxieties about taking their young children to health services for well baby visits or even for sick baby visits. And so we know that because of these disruptions to essential health interventions, there is an estimated increase in child mortality that may occur. We also know, for example, that a third of caregivers in the US context reported delaying making well baby visits or well child visits during the pandemic. And we also know that because of a change in lifestyles experienced in different parts of the world as a result of lockdowns, which of course varied from context to context in their nature of restrictions and in the duration of restrictions, it meant that the basic activity levels of families of young children were changing, as well as quality and access of diet. And this also has resulted in estimations that show that there is a change in the nutritional well-being of young children. So based on this global data, we are all reflecting as a community whether there's an opportunity to build back early childhood systems, not only better, but also more equitably and fairer. These systems were already poorly invested in prior to the pandemic. So does this disruption offer opportunities for us to learn lessons, to think about the way we want to structure and respond to young children's needs over the next few years? And while the global data provides us with big picture about the major risks that young children were exposed to and their consequences, what we set out to do as a collaboration across mobile creches, across Tiny Totos, was to understand whether localized data is useful for implementing partners to be able to tailor their response strategies for young children and their caregivers during the course of the pandemic and in the years to come, as well as whether this was an opportunity to strengthen the use of evidence within implementing partners, to use research data and to build the capacity of collecting research data in a way that is operationally helpful for organizations. So it was with that goal in mind that we set about developing the survey, which was designed to explore the impacts of the pandemic on young children, their caregivers, their environment. So the objectives were to gather information on the health, the education, the economic, and the psychological impacts of the pandemic on children and their families, as well as to understand the needs of children and families and their communities across these settings, to prioritize what actions families perceived as important in the coming years. The questionnaire itself was offered to all Saving Brains grantees, and it was a standardized questionnaire where the minimum time was expected to be 20 to 25 minutes per household. And there was flexibility offered in how that questionnaire could be administered. Depending on the situation on the ground, it could be in person, it could be by phone, and organizations could use paper and manually record data or use tablets. And there were both core modules, which we wanted for every organization participating to collect, as well as optional modules that could be selected by organizations. And both Mobile Creches and Tiny Totos selected a number of the optional modules in addition to the core modules. So the core modules, first of all, looked at information about the caregivers, the primary caregiver who was responding to the survey, covering issues like life satisfaction during the pandemic, mental health, physical and nutritional health of the caregiver, their interpersonal relationships and family conflict, and changes in their routine and responsibilities. We also wanted to understand better the disruptions to household economic circumstances and access to resources and services that impact the young child as well as the caregivers themselves, as well as, of course, understand the impact on children across those domains of health, nutrition, development, and education, and understand the issues and knowledge and awareness about the pandemic itself, about the COVID-19, from the level of the community as well as within the household. Optional modules allowed us to further explore these issues with additional information on other caregivers in the household, on the access to the nature and the quality of diet that people were able to have during the different times of the pandemic. And although it's continuing, we hope it gives us some insights into what is happening, as well as an option to explore the health, nutrition, development, and education of youth, stigma related to the pandemic, and healthcare utilization within families. So both Mobile Creches and Tiny Totos implemented these surveys to really understand the direct impacts that the pandemic is having in their communities. So I'll first describe the context for Mobile Creches that builds on these the videos that you saw, which describe the scene and the services that Mobile Creches provides. So Mobile Creche was able to implement the survey to close to 200 caregivers across 3 locations that they operate in India: Bangalore, Ahmedabad, and Delhi. And this covered 19 childcare centers with 2 types of creche models: a tripartite model, which is run by NGOs, and a direct delivery model, which Mobile Creches themselves implements. And it covered children under 3 to 6 years of age, and just over 6 years of age as well. And it's important to highlight that this data was collected in person between April and August 2021. And this is important because it was during the second wave of the pandemic in India, which was quite disruptive. And so a great deal of thought went into this by Mobile Creches for the safety of their team, as well as for the importance of how they could support the families and children during this time. So just to highlight here that the majority of children that the data was collected on, 66%, were between 2 and 5 years of age. And also in the Mobile Creches sample, about 3/4 of the children were female in all the sites as well as overall. And a small percentage, 14% of the children that were reported on by the caregivers were actually born after the start of the pandemic. And the main responder for the survey was the mother. In contrast, the Tiny Totos sample was a little smaller, 50 for caregivers, covering children under 5 years of age. And data was collected in April, and it was both electronically and in person. And this was in Nairobi in Kenya. And there was a little more balance in terms of children under 2 years of age and children between 2 and 5 years of age at 44% and 56% respectively. And with both male and female children, with 54% female children and 46% male children. There was a slightly higher proportion of children surveyed who were born after the start of the pandemic in the Tiny Totos sample, which was around 30%. And similarly to Mobile Creches, the majority of caregivers that responded to the survey were mothers. So while there is an incredibly rich source of data, in the interest of time, I'm only going to highlight particular modules. So we'll talk about the broad impact on young children, both under 2 and between 2 and 5 years of age. We'll talk about the mental health of caregivers and the changes in the resources that households were able to access. So beginning with the children under 2 years of age, for Mobile Creches, children in 2 of the locations out of 3 had experienced some loss of a caregiver or a sickness of a caregiver, but this was a relatively small number of children. There were fewer changes that were observed by caregivers relating to children's physical health, their nutritional well-being, or their emotional and behavioral problems. but there were decreases in the amount of time children could play with others or outside. And this is, of course, partially related to the period of lockdowns that were being experienced at the time of the survey. Importantly, most respondents believed it was safe to continue to breastfeed during COVID, and they had received some information about COVID from a nurse or other healthcare provider. And similarly with Tiny Totos, again, there were few children that had experienced either a loss or a sickness of a caregiver. In terms of concerns, the major concerns among caregivers was around the physical activity, the nutritional well-being, and access to play of young children under 2. There was less concern about the physical health of young children under 2 or their behavioral problems. And similarly to mobile creches, respondents did have information about COVID-19 provided to them by a nurse or other health provider, and they had understanding that it was safe to continue breastfeeding young children during the pandemic or during the period of the COVID. So in terms of mobile creches, in terms of looking at the details of the data, what we can see in this slide is that the majority of concerns were around the decrease in physical activity of young children, which was by just over around 26% of caregivers. And it was a concern by about 1/5 of caregivers about a decrease in weight of the youngest children, and a concern about behavioral problems, and emotional difficulties, where 33% of caregivers reported an increase in the emotional difficulties of their youngest children, and 28% highlighted concerns about increases in behavioral problems of their young children. With Tiny Totos, the biggest concerns, as highlighted, were related to the quality and the quantity of food that young children were able to access at this time, and this was decreased in about 26% of young children for the quality, and 39% of young children with regards to quantity of food. And weight loss was reported by more than 1/3 of caregivers about their youngest children. So in both settings, generally, and as we'll see when we come to the next set of slides, there was more coping for children around under the age of 2, and more support strategies and mechanisms that seem to be working. However, what was flagged as key concerns that needed targeted support was around the nutritional well-being of young children, where targeted mitigation strategies were needed to improve or reduce the impact of the change in the quality of diet, and to reduce the risk of weight loss in these very young children. But as I noted, the bigger concerns that seem to be reported were for children who were slightly older, in the 2 to 5 year category. So beginning here with the summary, firstly with mobile creches, there were few changes that were noted in the physical health of young children in this age group, their nutritional well-being, their emotional difficulties, and their behavioral problems. In terms of diet, there was particular concern that in this age group, there was a lower consumption of animal source foods, dairy products, nuts and seeds, whereas consumption of other key foods stayed similar or decreased less. In terms of stimulation activities, caregivers did utilize the opportunity of being at home, being in lockdown with young children, to engage with young children around play and communication activities. And in particular, in the Indian setting, this was with reading to young children. Partly because of lockdowns, there may be a decrease in the expenditures related to early childhood care and education. But most caregivers flagged concerns that they believe that their children's ability to continue learning had either stayed the same or it had decreased. And most caregivers were concerned that it was going to be difficult for their child to catch up if they had fallen behind. With tiny Totos, the main concerns by caregivers for this age group was nutrition related, weight loss, and again, sleep problems experienced by children in this age group, as well as an increase in emotional difficulties of young children. Again, there was an engagement of caregivers with their young children in learning activities. And in particular, this was around naming, counting, and drawing with their young children. Because there was a difference in the lockdown experience across these two settings, there was increased concerns around educational expenditures in the Kenyan settings. But despite all the difficulties, children's ability to continue learning seemed to increase. And this might be because of caregivers' closer engagement in learning activities. However, the same concern is that if children are falling behind, it would be difficult for them to catch up in their learning after these lockdowns and closures. So just to highlight the difference in the daycare closures in each setting, 81% of daycares were closed for a period of time in India. And this was a smaller proportion, 55% in Kenya. And the purpose of this survey is not at all to compare and contrast the two settings, which had different experiences about the pandemic and different restrictions, but it's just to help explain why we might be seeing some of these differences. When we look at the situation in India, despite these daycare lockdowns, it's important to say how much the organizations were able to significantly support their children, their communities. So 59% overall, and fairly high proportions in each of the individual settings in India, were able to provide their families, their children, with information and guidance about the pandemic, as well as 42% overall of their caregivers and children had access to either mask coverings, hand sanitizers that were provided by the organization to their catchments. In addition, Mobile Creches was able to continue providing some degree of educational support to the children in their catchment and their caregivers. This was around 53% overall, with variation across those three sites ranging from 72% overall, and with variation across sites ranging from 86% in Ahmedabad, 100% in Bangalore, and about 53% in Delhi. And Mobile Creches was also able to provide food supplements to children and families in their responsibility in their catchment, with about 75% overall, ranging from all their children that were surveyed in two of the sites, and a slightly smaller proportion in Delhi. And in the panel discussion, Mobile Creches can also explain the variation of what was happening on the ground in Delhi compared with Ahmedabad and Bangalore. Technology was an important part of the response during these peak periods of the pandemic that was reported by caregivers, with about 55% saying that technology was one of the platforms or ways in which remote learning was offered or support was offered by the organization to families. And much of this was also around the use of WhatsApp. So in summary, there were context-specific changes for children's time use. So the implication of this is, of course, that there's more work that's needed to identify what is the variation of time use, the way that families are spending time with their children in learning activities, and how can these be promoted better in future crises or even ongoing as we're recovering from these peak periods of the pandemic, which are likely to continue in the coming years. There's also a decreased ability of children to continue learning and perceived difficulty in children catching up. So there is a need to work with families and work with daycare providers for additional pedagogical support that can be directly provided to parents and caregivers to support their children should there be signs of failing to catch up. But one of the bigger concerns, and this was both in mobile creches and in the Tiny Totos survey, was the concern about the dietary well-being, the nutritional well-being of young children, particularly in the decrease in the consumption of some essential food groups. And so there's a need for potentially targeted financial support, social protection, the ongoing provision of school or daycare meals to help children during this recovery period. With Tiny Totos, it's important to note that in this smaller sample, Tiny Totos was able to provide outreach and information on the COVID-19 infection to nearly all of its catchment, all of its families and children that it served. And about half of those families reported also receiving essential equipment like sanitizers, like masks from Tiny Totos. And similarly to mobile creches, Tiny Totos was able to provide educational support for children. At 80% of caregivers reported receiving that educational support during this crisis time. And 80% also reported receiving learning or play materials during this crisis time. And again, the use of technology is highlighted with just close to a third of families reporting that the daycare used technology for remote learning during these closures. So there were specific implications. First of all, given the worsened nutritional situation for children in this age group and the inability to access all of the foods that households would typically access, there is a need for additional targeted support for families and market-based interventions to improve food access and affordability. There were concerns expressed about the emotional difficulties that young children were experiencing. So again, there is a need to strategize around emotional support and counseling that really responds to the situation of children in this age group. In this particular age group, there were concerns about educational expenditures. And again, and we'll come back to this when we talk about the disruptions to households' economic circumstances, there is a need to think about how to coordinate financial support. And of course, this isn't the responsibility of individual organizations alone, but connection to services that are available in these communities needs to be considered. And some families didn't have access to remote learning. So how do we make the response that we have during crises like this equitable? How can we expand the footprint of the type of remote resources that we can offer during times of crises? Moving on to caregiver mental health. Here, it's important to say in the situation that Mobile Creches survey captured that large numbers of caregivers had experienced, the majority of caregivers had experienced symptoms of anxiety, worry, loneliness, or depression for at least 2 or more days of the week. And about a third had experienced these symptoms for about half of a typical week. And this was also seen in the Tiny Totos survey, where about a fifth of caregivers had experienced symptoms of anxiety or nervousness, worry, loneliness, or depression for at least half of the week. And of course, these differences with a slightly lower proportion of these symptoms being expressed in the Kenya setting might be related to the different times these surveys were conducted, the different points at what was happening with the pandemic in these different settings at the time of the survey. But this points to the need of targeted support around mental health. And I think the Tiny Totos video captured that very well. All of these issues are, of course, going to be related to what was happening at the household level, the disruption to income, the disruption to the economic circumstances, and the disruption to food security and access to supportive services. So one of the things that's highlighted in India was that 60% of households either had a decrease in their income or had a complete loss of income during the time of this survey. And so this would have a substantial knock-on effect in terms of their ability to invest in their children, in terms of their ability to care for themselves and other family members. Mobile Creches survey also reported that the key services that were disrupted, that families really relied upon, were, first of all, childcare services, child protection services, and social protection services. Food security was also a major issue, where 12% of families reported not being able to eat for a whole day during this period, and 28% reported having to skip at least one meal in the last month during this period. So again, attention to food security is essential as a basic in order to help children thrive. So key implications were around addressing the social protection issues in a household and thinking about how to connect households and how to advocate for households that are disadvantaged in local communities with respect to financial support, not just during these times of crises, but also during times of recovery, as well as having market-based interventions that really address the issues of food security during these crises time. In terms of going forward, and one of the questions asked about the next 6 months, 52% of respondents in India said that they felt that they would need to either borrow money from lenders, and 77% said that they would be reliant on borrowing money from friends or families in order to help them recover from this initial shock. Moving on to Tiny Totos, 82% had lost income or salaries, and nearly all, close to 98%, said they had at least seen a decrease in their income or salary during the time of the survey. And again, this has knock-on effects on the well-being of the family. Similarly to mobile creches, the key sectors and services that families were less able to access were childcare, child protection, social protection. And in Kenya, also families reported about 36% reported disruptions to the healthcare services. And of course, this is going to be a result as a mixture of actual disruptions at the supply side, but really also fear and anxiety of taking young children or taking themselves to healthcare services. Again, there was an anxiety and worry, with 90% of families worried that they would be running out of food and unable to adequately provide for their children, provide for their families. 40% in the last month had gone without eating for the whole day, and 66% had skipped at least one meal in the past month. So again, highlighting this important issue of disruption, that means households are unable to function in the same way if there is hunger. So similarly, the implications of this disruption to households is the need to advocate for and connect people during times of crises and in the coming months and years during the recovery period to targeted financial support, but also to have more equitable access to social and healthcare and childcare services during these periods. And again, market-based solutions around food security, which has such a direct implication to children's nutritional well-being, as well as the well-being and health of their caregivers. And again, when looking to the future, 82% of respondents in the Tiny Totos survey said that they would need financial support in the coming 6 months. So this provides a very high-level snapshot of some of the key findings in the survey. But as I said, I'd be happy to also report on additional data that we have on some of these both core modules and optional modules. But this is really an opportunity to now open up to ask more questions about this survey. And so I want to first begin by inviting Mobile Creches and Tiny Totos to the panel discussion. And before we open up to the broader participants, I want to start by asking or highlighting a couple of things. First of all, Mobile Creches and Tiny Totos did a remarkable job during a very difficult time of not only sort of managing this additional data collection, but actually responding to the needs of their families, to the needs of their children, by providing information and support around the pandemic itself, around COVID-19. Also finding ways to provide remote-based and educational support, as well as other learning supports, and looking at ways of using technology. So I wonder if both organizations, perhaps starting with Mobile Creches, could explain what their decision-making was and some of the details of what they did on the ground during this time.
Thank you, Aisha. I just want to bring our responses in the COVID situation 1 and 2. What was the difference? Because a lot happened because of the whole structure that was already laid out in the COVID-1 response. That was 2020. We had already formed state-level teams within the organization where we involved all verticals, so program, supply, finance, everyone together, and we divided into different states. We are right now spread across 12 states. So that system was already made in 2020. We already developed a remote learning program, Furthering Parenting, which was parents were given tips on education and what chapters, what lessons to be learned, which you spoke about. we already had a distribution change laid out. So all those things were already done. So when this time it happened, and we had an adaptive strategy made, and we knew what to do. And we had, so what we did was this time stress, because of the health factor and the whole medical emergency, we stressed more upon tracking the health outcomes of the children and the family, because of the whole secondary infection which can cause. And we also focused on we focused on getting vaccination camps held in the construction site, advocating with the developers. So we had consultation held somewhere in the month of June itself, so that they can together we can have vaccination camps. We can also have there were there were units. The creches were converted into isolation centers for any family or anyone who has fallen sick. So we did all that part with the developers. So the preparation happened, and we were supplying, you already mentioned, we were supplying the survival kits, nutrition for the children, all the medical, the COVID response kit with the sanitization and various other things. So these things, this is what we did. So daily tracking was what we were focusing on. And additionally, from the last learning, we had already started our conversation with our partner CSO, Sesame Workshop India, on the SCL intervention, because there was a lot of need for mental health that came up. And we started that intervention, which briefly got disrupted in the month of April, but we quickly restarted the intervention from the month of June. So this is a brief about how we tackled the situation in 2021. Thank you.
Thank you. I wonder if Mildred and Faith, if you'd be able to describe some of the actions you did on the ground during this time, which was reported by families in terms of the educational and COVID-related support.
Okay, so you find that just like happened to many people worldwide, the effect of the pandemic was difficult on people, and there was less work and therefore lower attendance observed at our daycares, as mothers could not pay for childcare. And this is data that we have in our revenue and attendance data. However, we also had some positives. So our key positives is that we were able to support these ladies, or managers as we call them, to keep their businesses afloat. And this, I think, is largely attributed to prior business training, plus diversification of services and revenues. For example, we got them to start selling nutritious porridge, which we provided to them at a certain cost, and they were able to sell and make a markup, sanitizers as well, and clean cook stoves. So because the numbers at the daycares had reduced, they were able to make a little more income from engaging in other product sales. And we also had diversity in our education content, which I think is the biggest takeaway for us from this pandemic. We're able to engage parents more than we had ever thought or imagined possible pre-COVID. We're able to digitize, even if to a small degree, content and communications. And so you find that although our business matrix went down, because there's actually a 33% drop in attendance in our daycares, our child outcomes actually improved. And so this was something that was really exciting for us. Yeah. So that's how we mainly engaged our community, just by the improved education programs, supporting the managers with diversified, business. And of course, sorry, one I didn't mention, just partnerships with other key players, talking about hand washing, just the general hygiene, training around the general hygiene, just as was done by mobile creches as well. Thank you.
I think for me, one of the sort of interesting pieces in both of those reflections is the preparedness and the protectiveness of just having a strong childcare system can support families during crises, because the team of support is in place and ready to respond, which I think was so beautifully highlighted by both organizations. My next question, and I'd love to hear your reflections on this, is what was the experience of actually being able to implement a survey, and how useful how were you able to use the experience in terms of strengthening the organization's capacity in terms of using evidence to inform action, or using evidence to inform sort of the way you operate in a program? And maybe I'll start with Faith and Mildred here.
I think I'll let Faith take that. Faith?
Thank you, Aisha. So as Tiny Totos, once we were invited to participate in this survey, we were really excited and interested because of the expertise research experience by Harvard, and on how they conduct their field research, and we also wanted to improve on ours. So the first thing that we did first was we went through the questionnaire to understand all the different aspects of it, what we expected to answer in that questionnaire, and also what was expected from us. And then after that, we also got a target group of 50 respondents. We were dealing with a smaller population, so we opted for 50 respondents, and they were classified into two strata based on the age of the children, that is between less than 2 years and between 2 years and 5 years. And then also based on their ages, we got like an equal distribution of both sexes, the females and the males. And then after we did that, we decided now to translate our questionnaire into Kiswahili or Swahili, because that is the language that most of our respondents understand. And also it was to help the people conducting the field study to maybe translate or just dig deeper wherever the respondent might not have understood. And then after that, now we uploaded this questionnaire into a data collection tool called Mubenzi that was used to capture our data. And then we trained our community educational experts, who were supposed to be the key personnel in the field collecting the data for us, on how to accurately capture this data into our tool. And then after that, we went to the field, we collected the data, and we sent it to the Harvard team for analysis. That's just what Aisha has shared. And then now there's some of the things that we as an organization did to adapt to this survey. And the first thing we did is that we analyzed each question to ascertain its relevance to our setting, so that it could meet both family needs, cultural needs, and also the daycare needs. What I mean by this is that we had to tweak some of the questions to include choices that the respondents needed a more sensitive approach, like for instance, questions that asked about violence and alcohol use, or also an instance whereby some of the responses were not applicable. An instance being, there was a question about the amount of alcohol consumption. So we had to include an option of maybe not applicable should the respondent use, like if the respondent was not taking alcohol or something like that. And then also as an organization, we also decided to do a baseline survey with just 4 respondents to just see the average time that this survey was going to take. In general, I think Aisha, you said it was 20 to 25 minutes. So we had to ascertain that. And then also based on this, we had to be really, really flexible as an organization. Some of our respondents maybe were going to work as early as 5 a.m. in the morning. We had to ensure that our data collectors were actually at the daycare at that time. Some came off at work very late. We also had to be flexible to ensure that we were working with the respondent's schedule instead of our own schedule. So that is what I can just say we as Tiny Totos did to adapt to this questionnaire. And also the last point is about also we had to also work on a specific part of the questionnaire. Apart from the core modules, we realized that our population or our target group is just between the ages of 5 and below. So there are other aspects like above 5 years that was not really like our population, or that's not the kind of population we work with, and we just had to adapt our questionnaire to just fit that specific age group. So that was how we did it as Tiny Totos. Thank you.
Aisha, if you just allow me to comment on the question you had asked, how did the survey inform our practices, or what was different? we're not research giants, to be honest. And this was such an interesting opportunity, but you know, I believe and we believe in baby steps. So one of the things we felt was that, some of the learnings is that our volunteers felt that by undertaking this survey, it helped them to become, you know, better field workers, both from a methodology point, as well as skills like patience when dealing with the respondents. And they say that the survey gave them exposure to what is actually happening at the society level, because many did not expect the answers that they received. I think there was a lot of assumptions that everybody was okay just because you saw people walking like they were fine, that they were doing okay. The volunteers said that post this survey, they improved on their questioning techniques. Daycare owners talked about just having to take charge of informing their parents, inviting them into this kind of study. So although we didn't do like, we didn't take the findings to improve very specific things about our program, what I think was the best outcome is what it did for us within the team itself. The community health workers, the community, we had a mindset shift, you know, to know and begin to understand the importance of research, which is something that if it was not for this pandemic, to be honest, we would not have probably done at this level. So those were some of our learnings, and we do hope that in future, with those amazing findings, we'll be able to even further, you know, improve our practice. And very grateful, especially for the post-survey training and support that we have continued to receive from Harvard, which is helping us to work on improving our developmental assessments, first as a team, and then breaking it down now to our caregivers. And those are baby steps, as I said, but we've started with our first steps.
Thanks so much, Mildred. Deepshika?
Yeah, thank you, Aisha. So I think that like much of the experience for mobile creches is also similar like Tiny Totos as far as the process is concerned. So we did the similar thing. First of all, we decided the exact locations where we have to conduct the survey. So for us, it was 3 different locations. So what we did, we constituted a team at the state level, and the CSO partners were involved in this. So we had the questionnaires, we translated it into Hindi language, regional language, and then we conducted the orientation of our CSO partners. Like we also discussed about the contextualizations as per the requirements of the different states. So after the orientation was done, there was a better understanding of the questionnaires, and we also we conducted a kind of mock questioning so that for each question, the participants are or the data collectors are comfortable. And after this, like we started to go for the data collection, but as soon as we started, you know that the second wave it hit us. So we just completed our 1/4 of the data, and like by that time the second wave was there. So there was much disruptions and the challenges in between. But initially there was the survey, it just slowed down. It was not completely closed, but gradually when the situation was really aggravated, we had to completely shut it down. It was like government restrictions was there. And as Chavi mentioned, that was the time for mobile creches to get into the rapid response to the community. But for mobile creches, we were trying to gain the data in person, and also it was paper based. So that was a real challenge for us because we committed on this. Like all the partners were not trained digitally to capture the data. So that was a challenge for us, and I will say that that's the kind of learning as well for us, because now it's the time for us to realize that we have to universalize the tech-enabled solutions within the organizations. And I'll say that for mobile creches it is there, but the real challenge for us is that to build the capacities of our CSO partners as well for the data collection through like using the digital and the mobile apps. So this was the point where we faced a challenge. But as soon as the COVID situation, it was relaxed, the restrictions were kind of lifted up. We soon resumed the data collection by like in the first week of June itself. But again, it was very staggered. It was in staggered manner. There were many loopholes. After a period when the situation was completely okay, then we started to have a pitch over there, and like it almost took us 5 to 6 months to go for the data collection. Otherwise, if there was no situation like this, we could have completed it much earlier. So by end of August, we completed the data, and it was there, and we just entered it into the Kobo app, Kobo Collect app. We also validated it. So there was, within Mobile Creches, there was an internal team which was responsible for the monitoring and validation. So like it was the real challenges of the second wave, where we were like very much struggled, but fortunately, like the whole data was covered for whatever sample we targeted. We targeted for the 200 sample in total, but in actual we completed for 190. And if I come to the based on the experiences of this survey, so I will say that it was a wonderful opportunity for Mobile Creches to participate in this survey, because it really informed us in form of data. It has given some very good feedback for what we can do with our program intervention, how we have to adapt to our delivery approach. So we had a lot of discussions, and we are feeding these implications in our new strategy as well. And there are many components on which we are trying to work, so that, like, for instance, responsive parenting is there. We are also trying to embed socio-emotional learning component in our existing Balwadi curriculum. So this is a really very, very good evidence we have gained, and based on this, we are also in the thinking process, and it will go forward with the whole planning and the model development and everything to be in place. So yes, so I think that if I have to just say that one of the best learning from this survey was that we have to think in a very ecosystem way, in a very integrated manner, because one thing impacted the other thing. So now our focus is on to strengthen the whole ecosystem, as we, like, the findings has shared that there are many financial implications on the family. So everything has to be think in an integrated manner. And apart from this, as far as monitoring and evaluation is concerned, we are also trying to find out the ways how to strengthen our monitoring and evaluation, so that it is more adapted to to be implemented in situation of crisis or emergency, like maybe including disaster also, or any other climate induced situations. So this has really given us a very good insights to think for the way forward. So yes, from Mobile Creches, this was our experience, and it was really wonderful to participate in the survey, and the learnings are really rich.
Can I just add to this? What it did to us immediately when we got the result was, I completely echo with Mildred that it was a shock for the program team to see that was a result, and this is what is happening. And we immediately started, we focus on nutrition. So because the centers were closed and we could not get children, and then slowly we started getting children in smaller numbers, the whole focus became on spot feeding. We were already supplying nutrition to the families, but we realized that to see what goes inside a child's mouth is very, very imperative, even if it is one meal that we witnessed that the child is eating. So immediately that did that. And monitoring evaluation has been weak in Mobile Creches. So this has completely come that how important it is. In our future plans, like Deepshika mentioned, we have developed completely a new program on parenting for the non-creche users also, where it's going to, we realize to strengthen parents is very, very important, and to strengthen their practices, their knowledge level is very important. That came up. Then the whole linkages with the provisions and schemes, community development, that part we have to strengthen much more than what is happening right now, creating creche monitoring groups in the community. If we are not there, there is already a constitution of community members, maybe some government functionaries. They are there to support in functioning of not only centers but the children if the centers are closed. So these were some things that emerged out of this, and the whole part of tech learning, tech transmission of our trainings, because we partner with different CSOs and develop them as ECD experts. So, and we are across different states. So if we cannot travel to different states because of the whole lockdown and the situation, we should be able to continue with the tech, with the TOTs through a tech base. So the app development. So all that is now come up, and that's how we have planned our next 5 years, seeing the result. Thank you.
Thanks so much, and welcome any questions from the participants on the webinar. And I see there is one from Ha. Ha, would you like to ask your question?
Yep. Thank you, team Mobile Creches and Toto, and thank you, Aisha, for the great presentation. Very informative, a lot of good practice that we can learn from your story. I'm Mobile Creches and Tiny Toto. So I have two questions for you. The first one is, did your survey investigate the father and mother's different roles in childcare during the COVID? Is it different from before the COVID? And second, it would be good if we know about the protective factor that support for the family. They have good parents and child interaction, good child care, because knowing those protective factor, we can disseminate and adapt to another setting, and those will be the indicator that we should add in our intervention in the future. Thank you.
I'm happy to respond on the data side, but I want to check if whether Mobile Creches or Tiny Totos has any reflections on those questions.
Yeah, Aisha, yeah, thank you, Han, for your question. I think that I just missed to mention one thing here, that like when we just submitted the survey, we were before the analysis, we were reflective of the what could be the findings. So because this was a standardized questionnaire, there were some questions which were very specific, but best thing is that based on each questions in this survey, we also was understanding that there is a need for getting into the depth of in order to understand the whole context, the perspective, as you have mentioned in the question, that the parent-child interaction and these things are very important. So we just got some insights that there is a need of some qualitative research also, and after this survey, based on the findings, we can pick up the research priority areas, and then we can go into the depth and we can find out what's the real situation and what are the factors which are causing these things. So this is related to not specifically to answer your question here, but I think that this is why I'm mentioning here is that it is giving us some insight to get into the detail of the core findings and the implications we are having. So similarly, there are many other issues. So for instance, the socio-emotional learning, and the mental health is impacted. So we were thinking that there's a need to understand in a very qualitative manner within the community that why, for instance, toxic stress or some other factors are there. So why the situation is there. So this, we felt that there's a need to do some sort of further research.
Maybe I'll just briefly say that we had a whole module and both organizations collected data on protection issues. So we had a modules around family conflict as both in terms of between caregivers, the adults in the family, as well as between caregivers and children, as well as tracking whether there were changes or whether things stayed the same in terms of violence within the household, both at the level of the caregiver and the child. And I think these help sort of understand what was happening in terms of vulnerability and protection implications within households in both settings. So that data was collected. With respect to the being able to delineate between the mothers and the fathers, we definitely were able to look at changes in caregiving practices, but in the interest of time, the survey focused on the caregiver who responded to the survey, and for the majority of, and I think this can be confirmed by Tiny Totos and mobile creches, from my recollection, the majority of times that was about the mother. Yeah. Checking whether we have other questions from participants.
Thank you.
Thanks, Ha. Jamie.
Sorry, getting unmuted. Thank you. This was really very interesting, and I appreciate the range of observations here. I was especially just wondering, hearing from Mobile Creche, that one of the things you highlighted in your comments was community supports and connection to community supports, especially at a time when, you know, the community was under stress and even fragmented by the pandemic. So I was just curious if you could, Tiny Totos may have comments on this too, but if you could reflect on that a little bit more, elaborate a little bit more on what that looked like and what your observations are.
So are you talking about what we did during that time, or what we are planning, what we feel is a gap and what we need to strengthen? The plan.
I actually meant what was happening during that time, but if you want to highlight gaps too, or things to do for the future, that's naturally very interesting. So,
yeah. Okay, thanks, James. I'll talk about what we did with the community. So we already have community leaders as part of our program, which are from the community itself. They're called Sati Samu. So that it literally means that a community support person. So it means that in English. And so they were already there, and with them and the developer, so a person in developer, there would be a guard or someone from the developer side. We were in touch with them, and they were the key people who supported in the distribution of the nutrition, because we were not going there physically on our own, but the distributor would go there, their person will go there, and they will then, the community leader and the one person from the guard, say the developer's guard, would help them to give nutrition to the families, taking COVID precautions. So we had supplied all those kits to them where they wear masks and observe all those COVID precaution protocols. So that was one. And then keep a close watch on what is happening with the families, who is falling sick. So every day there was a tracking sheet on, is there any sickness in the family? That would also mean the families who are not sending their children to our creches. So they were not even our outreach number, but we were tracking the entire community to avoid any secondary infection, or if they need support. So we already had a group, a team there to link them to any emergency situation. So doctor consultation or partner CSOs or who are working in the health front, the government linkages, if we can help them with the providing, or with the developer talking to them. If there's any emergency situation, who's the doctor, where can they go? Of course, we didn't provide that medical we didn't provide the hospitalization, but we linked them to the source. That's what we did, but we were doing that very, very in a detailed way. So like I said, that we spoke to the developer to have an isolation center. Luckily, it was not used in any of our site, but the creches, I think it was on two developers actually made isolation centers, with, for any emergency, if any labor, any worker or anyone falls sick. So that was all that was done. So yes, that, and I'm just wondering what else we did. Broadly this. So what we are planning now, we realize that has to be really strengthened. So there's one Sati Samoor or two or a couple of Sati Samoor, but that whole system of creche monitoring or that support within the community, that becomes very, very important. We have realized that, and we're going to strengthen that. And during the opening phase, because we don't know if it comes again, goes again, we have to really work upon the linkages, because there are many provisions which government already has the schemes, various for the worker, for the pregnant lady, for different schemes, or for the nutrition, there's a PDS, so the different schemes. So we don't wait that it happens when it happens again, but we start off doing that. So this whole thing of needing to be strengthened is what we realize it is that we need to do.
Yes. Focusing on the preparedness part of the community, because this is a kind of lesson for the entire system, that we have to develop the preparedness of the community, with the whole approach, and also to make them aware of different schemes, and then leading it to the linkages.
James, just last one thing. We were also getting vaccination camps organized. So again, licensing with the government health departments or with the CSOs partners who are doing the vaccination camps. So that, and tracking how many have got the first doses. We were doing that for the adult. That time it was only for the adult, and we had, I think, 40 plus people, or 35, that was the age group which government had opened up for vaccination. So we were getting the vaccination camps also held in these sites.
Thank you. Just noting there we're at time, but I really wanted to thank both Mobile Creches, with Chavi and Deepshika, and Tiny Totos, Mildred and Faith, and not only the four of them, but the incredible teams that were working with them to really bring these data and to do the work on the ground. And I'd also like to acknowledge Lily Blitz-Nashka, who helped with the analysis of the data. So thank you, everyone.
Thank you so much, Aisha, for giving us opportunity to get the insights of the findings and for sharing the presentation with us. Thank you, everyone, for joining.
Thank you, Aisha. Thank you, everyone. Thank you, Saving Brains. Thank you.
Thank you. And we'll have one more upcoming Saving Brains event, and I know it's that time, but we'll send out an email with more details about it. Penny, did you want to say a quick word for those who are still on the call?
I think not, Jasmine, you're right, we're at time. Thank you all very much for today, and we'll send you details about the next one next month. Cheers.
Thank you, Aisha. Thank you, Mobile Crash and Tiny Totos team.
Bye. Thank you.